Hi, everyone. Thank you for joining us for the second session in this three-part webinar series on youth sports policy. I'm Julie McCleary, a professor at the University of Washington and co-director of the Center for Leadership and Athletics there. I'm really glad to be here with you and excited about the four fantastic guests that we're going to hear from today. So before we jump in, I want to revisit a few of the big ideas from our first session on April 8th, especially for those of you who weren't able to be there. And then we'll set the stage for where we're headed today. So in our first webinar, we answered a pretty simple question. What is broadly the current state of youth sports policy and governance in the US? And we heard from several amazing experts on that topic. And Dion Kohler, a legal scholar from the Center for Sport and the Law, reminded us that we've arrived where we are essentially because there's been tremendous growth and change in the private youth sport sector with very little policy or regulation. And then Cam Casaglis, the president of the US Center for Coaching Excellence, gave us an international comparison. And he told us that in most countries, youth sports falls under national ministries that set clear standards, goals, and guidelines. He also noted that these goals and guidelines are often built on an interest in sport as a public good, a youth development tool, and or a social right. Then Renata Simral, executive director of the LA84 Foundation, highlighted that the US system, on the other hand, is primarily driven by market forces. And one consequence of that is that income strongly predicts access to sport. And then Dion left us with a very memorable warning. Those of you who are there probably remember that she said that when people hear the term regulation as it relates to sports, they often imagine the sport apocalypse, is what she called it. The idea that regulation will somehow ruin or end youth sports as we know them. And I often hear a version of this myself, something like it's a $40 billion industry, it's too big to rein in, the horse is out of the barn, we're never getting it back. So many conversations that I have on this topic, and probably you do too, are should we regulate or not regulate, right? Like what's going to solve sort of some of the issues in youth sports? But the reality is that policy and regulation are already here. So just yesterday, most of you probably know that Senators Murphy and Booker, along with Representative Chris Deluzio, proposed a new federal youth sports legislation called the Let Kids Play Act. A little side note on that, since it just came out yesterday, I don't think we're going to be able to get much into the specifics of the bill, but we're providing a link to a one-pager about it, which will get put in the chat. And I think we also have a link to the full extended bill. And that bill is primarily focused on removing private equity and predatory economic practices from youth sports. So it's not just this brand new federal legislation that's making it be a space where there's more regulation, but between 2024 and 2025, the number of state level youth sports bills essentially doubled from 37 to 75. So whether we all feel ready for it or not, the policy conversation is happening. And if we, the people who run youth sports programs, who coach them, who do coach education, if we want a seat at that table, it will help us to strengthen our policy fluency. So historically, youth sports policy has emerged in response to crises, concussion and cardiac deaths and injuries. The Larry Nassar case, even this private equity legislation is a reactive response. But we want us to think about in this moment, do we have an opportunity to build policy that's proactive, not reactive? And to think about what kind of policies we would want if our goal is to build a youth sports system that both prevents harm and promotes youth well-being. So as we think about that, for that reason, this webinar is going to be a little bit policy wonky, I hope in a good way. And for those of us who are steeped in youth sports, some of the language or framing might feel a little bit new, but hopefully we can stretch our imaginations and think what this might mean for youth sports, which brings us to what we're going to do today. So we're going to look at other sectors that were once loosely regulated or not regulated, and now are more structured by federal and state policy. And we're going to ask, what lessons might we learn from those stories? And what could we borrow to help in youth sports policymaking? So you'll hear stories from smoking prevention, childcare, out of school time, and school wellness. And as you listen, I hope you'll consider the following. So why did the regulation emerge? What harm was being prevented or good trying to be achieved? What mechanisms were used, like incentives, agencies, standards, enforcement? What challenges or pushback surfaced as part of the regulatory process? And then what outcomes followed? I think everyone will have those items in their story for us to listen to. So lastly, before we bring up the first guest, I want to ground us in one more idea, which is that we regulate things all the time for economic, social, moral, and safety reasons. And it's not because we want to limit opportunity, but because when children are involved, we think that they deserve safety, access, and environments that help them thrive. And the adults around them are the ones who are responsible for creating that. And so going back to the previous webinar, as Dion reminded us, when we think about youth sports policy, we should focus on youth and not on the sports, because it's the youth, it's the young people that need protection and support, not the sports. And one space that youth need protection and support is in public health and safety. And I'm going to end by just highlighting some of the major public health concerns that there are in youth sports. So regarding safety, while we don't have great data on abuse in youth sport in the US, we do know from the 2024 Safe Sports Survey that 78% of US Olympic and Paralympic athletes experience some kind of emotional harm, neglect, or mistreatment somewhere in their sports journey. And from a health perspective, we have young people who can't access sports and physical activity, too many young people, so that only 24% of the kids in our country are meeting the recommended 60 minutes of physical activity a day. That's vital for physical and mental health promotion. And then on the other hand, we have many young people who are over participating in sports in ways that lead to overuse injuries. So roughly half of youth sports injuries are preventable. And regarding those overuse injuries, I once heard Dr. Neeru Gianthi, who's a leading early specialization researcher, say, we know that early specialization causes overuse injury with the same level of certainty that we know smoking causes lung cancer. We just don't have the same political will to address the problem. So that is a good framing for our first guest, that public health framing and smoking reference. Leads us to our first guest, who is Susan Jaegers. She's the executive director of the Association of the Ohio Health Commissioners and former co-chair of the Smoke Free Ohio campaign. And Susan is going to walk us through the story of Ohio's public place smoking ban, which is a powerful example of how policy can shift culture, behavior, and eventually health outcomes. Thanks for being here, Susan.
Thank you, Julie. Thanks for inviting me to share the Smoke Free Ohio story. I'm always excited to talk about the progress that we made. I have 6 minutes to cover a campaign that took about 14 or 15 years, so I'll do my best. I'll start going way back when I was a teenager, young adult, and it's almost hard to believe how normal smoking once was. There were smoking lounges in the high school I went to. When I went to college, we were allowed to smoke in our college dorms. Bars and restaurants handed out free cigarettes. People smoked in offices, in their homes, in their cars, almost everywhere. And at that time, public health experts and healthcare providers knew smoking was harmful and that exposure to secondhand smoke was making people sick. But we didn't yet have the level of data needed to drive widespread policy change. That really began to shift in 1993. That's when the US EPA classified secondhand smoke as a Group A carcinogen, which meant there was no safe level of exposure to it and that it was a substance known to cause cancer in humans. That designation was really critical because it helped really spark what became we call it the clean indoor air movement in Ohio. Later studies, so somewhere in my timeline, other studies came out that would rank secondhand smoke as the third leading cause of preventable death in the United States after active smoking and alcohol use. So I think that's important that we had data come out along our advocacy path. Shortly after the US EPA classified secondhand smoke as a Group A carcinogen, action followed in Ohio. In late 1993, two local health departments used their authority to protect public health to issue orders to adopt clean indoor air rules to protect the public from secondhand smoke. They declared it a public health hazard and a physical irritant. Those early efforts mattered, but they didn't hold. The first regulations included some exemptions because the public health policy, they wanted to ease into it, but those exemptions were ultimately what caused the policies to be overturned when they were challenged in court. The ruling found that the health departments had crossed into lawmaking authority. And of course, these policies were challenged by the hospitality industry, restaurants and bars, but funded by the tobacco industry. So there was a lot of money to challenge these policies in court. In response to that, other health departments tried again. So this time they tried without exemptions, and those efforts were challenged as well, with mixed results in the courts. So, we had some action happening around the state. And this brings us to 1998 when 46 states, including Ohio, entered into the Tobacco Master Settlement Agreement. And that's when the states, sued the tobacco industry to recoup costs to treat sick smokers paid for largely by the Medicaid program. And as part of that settlement, internal industry documents were made public, and they revealed that tobacco companies had long known and deliberately concealed the dangers of smoking. So this helped our movement as well because it shifted the public understanding. Messaging around smoking became clearer, and then the evidence was undeniable because it wasn't just public health people saying it was the tobacco industry documents as well. So for the next couple of years, regulations considered and they were overturned. But really what happened then is cities and elected officials began stepping in. They adopted ordinances. And these were challenged too, but this time they were upheld. And I think that's really important, that local leaders stepped out and enacted these ordinances. And once they were upheld, that took away the risk for other elected officials, and momentum grew quickly. We had a lot of cities follow the lead of those couple cities that were brave enough to go first. And then we had more than a dozen communities having smoke-free policies. But that success at the local level also created a new challenge. We had some inconsistency. Policies varied widely. Some included exemptions, some protected all workers from secondhand smoke. And at the same time, the tobacco industry opposition really intensified, and they took their message to the State House. They wanted to push for a weak statewide standard that would keep local communities from adopting stronger policies. And that kind of law would have overturned some of the good policies we had in the state. So it became, clear to us that we needed a statewide standard too, but from a public health view, we needed a strong, consistent standard that protected all workers from secondhand smoke. So in 2005, we formed a coalition and launched a 2-year campaign to take the issue directly to the voters. The coalition gathered signatures, built public support, and made the case. And this time, the message really wasn't about where smoking should be allowed or not allowed, bars, restaurants, offices. We were talking about that all workers deserve to be protected from secondhand smoke like any other hazard at work. So just like Julie mentioned that you don't want to talk about sports, you want to talk about kids. That was kind of the decision we had to make too. It wasn't about where smoking should be allowed. It's that all workers, no matter where you work, deserve to be protected from secondhand smoke. So in 2006, despite a competing and weaker proposal backed by the tobacco industry, Ohio voters approved a comprehensive smoke-free law with 58% of the vote. The victory, as I said, didn't happen overnight. It took more than a decade. And it was really built, in my mind, on several key factors. We had strong data come out, and we had credible evidence. We really had brave decision makers and advocates willing to lead those early efforts. We had incremental local successes, and that built confidence and it built momentum. It allowed other elected officials to um, take action too. And then we had growing public support over time. We were the 11th state to go smoke free, so we weren't the first, but for Ohio, that was early in us being proactive in policy adoption. The movement really happened. It was, as I, outlined, kind of step by step, community by community, until it became the standard. Like some cities were jealous of other cities that had smoke-free policies, so the public really expected to be protected from secondhand smoke, to be able to go out, to a restaurant and not be exposed to secondhand smoke, to go to work and be protected from secondhand smoke. Um, and I will say volunteers and health advocates were critical at each step. This year, we're celebrating our 20th anniversary of Smoke Free Ohio, and now there's a whole generation of Ohioans who don't remember smoking in workplaces, restaurants, and bars. We know there were a lot of health benefits related to the adoption of that policy, but we're all better for it. And like I said, a whole generation doesn't even know smoking indoors was a thing.
Yeah. Great. Thank you so much, Susan. I think there's a lot we can learn from that. And one idea I want to pick up on is what you said about this idea of step by step, community by community, until it became the standard and expected. I think that's so true about smoking. And it's a little bit what's happened in youth sports. I'm going to say like around concussion policy, for example, right? That's been around. It's in every state. Didn't used to be standard and expected, but it is now. Whereas some other things like broader universal training for coaches around youth development when they're working with young people is less standard and expected. So I want to ask you, like, from your experience and the work you do in communications around public health, like, how does a public health message like reach a tipping point in public opinion? Like, what are the things that need to be there for that to happen?
Yeah, I think, what we experienced in this campaign and some other things that I've worked on is once you have, those brave leaders to go forward and you have a policy in place, it's always important to evaluate and get data. That was a part of everything that we did so we could say things were working. I mentioned we were the 11th state to go smoke free, so there were some other states that went ahead of us. They studied it too. I think one of the things that came out right away was most communities that went smoke free saw an immediate drop in emergency room visits for cardiac issues. So it's like collecting that data and putting it back out, saying we didn't do this just because we wanted to regulate you or have fresher air. It changed public health. So I
Yeah.
think it's that immediate evaluation of your policy and telling the public how it works.
Thank you. And we could have a whole separate webinar on the challenges of youth sport data collection, but it's good to know how important that is to a public health movement. Thank you. I'm going to bring up our next speaker and to introduce Joel. I'm going to just reference concussion policy again, because even though every state has a concussion policy, as Dion mentioned in the last webinar, most states, not all, but most states don't have mechanisms to enforce those laws. And a big reason is structural. So very few states have a central tracking system for youth sports programs. So if you kind of can't see the system, it's hard to regulate the system. So that's why we're going to turn to childcare policy as our next case study. In Washington state, childcare didn't start out as a regulated field, but over time, the state built centralized structures, licensing, monitoring, accountability systems, all in the name of safe, high quality care for children. And so our next guest, Joel Ryan, who's the executive director of the Washington State Association of Head Start, is going to walk us through how that transformation happened. So welcome,
Yeah.
Joel.
Yeah, thanks, Julie. And I'm going to start with Head Start and then and then we can delve a little bit more into Washington State and childcare licensing. When Julie asked me to participate in this webinar, my first thought is, oh, this is an awesome opportunity. It's like first take. I can talk about youth sports, basketball, NBA playoffs. I wondered why would she be having me from a Head Start perspective. And but I'm gonna walk you through a little bit of Head Start, and then we can absolutely talk about Washington State. So first, I just want to let everyone know I coach middle school basketball. So I know a lot about coaching. I coach my daughter for, I think it's like 10 years now, all the way through eighth grade. Then I've continued coaching with her. So I know a lot about youth sports. But I also know a lot about kids. So if you're unfamiliar with Head Start is a preschool program for low income children. And so you might be wondering, well, what's the connection there between these topics? But I'd say the one thing that I've learned is that children thrive when adults create safe, predictable, and developmentally appropriate environments. That's the idea that actually is at the heart of Head Start and youth sports safety. Head Start was created in 65, and there weren't any standards. So it started out as a small summer project program as part of the war on poverty. But in 1975, the Office of Head Start actually formally established performance standards for Head Start. And the reason was simple. Good intentions are not enough. Federal leaders recognized that children needed safe environments, trained adults, health protections, developmental support, and consistency across all programs. The standards were designed to ensure that every child, regardless of their zip code, had access to quality early childhood experiences. The standards help move child services from informal care toward accountable systems built around child development and safety. And then in 2000, there was additional research, and I know because there might be some professors on here because they like, so if I mention research, they'll get excited. There was a book actually called Neurons to Neighborhoods. There was a professor named Jack Shonkoff, who's actually, I think he's still at Harvard for the Center for Developing Children. And it reinforced why these Head Start standards matter. And this was actually new because with childcare and Head Start, people really thought about it as childcare. It's a place for people to put their kids while they're working. But the research in 2000 of Neurons to Neighborhoods changed that a little bit. And because they did some research and they found that children's brains develop through relationships and environment, chronic stress affects learning and behavior, supportive adults build resilience, and emotional safety supports growth and performance. Healthy development depends on safe, stable, nurturing environments. So just like youth sports, Head Start sort of started in the same kind of environment where it was, in a lot of ways, it also was, um, hey, these moms can do it because they're moms, right? And I know when I coach basketball, it's like, oh, didn't you play basketball in high school? Yeah, I was a high school player. Well, then you should be able to, you'll be able to coach basketball and you'll be able to handle all the safety stuff. And we didn't really have any training. So these Head Start standards are built to make sure there's safety, to make sure, and then the research around brain science, which actually UW has been doing quite a bit of work. So youth sports involves the same children and developmental needs. Um, Accountability includes coaching, training, supervision standards, consistent policies, and just like Head Start, we need to rely less on tradition and more on actual standards for safety and keeping kids safe. It's the same thing with childcare in the state of Washington. Do people want to be regulated off the bat? No, of course they don't. In 2015, the state of Washington put together, it was called the Early Start Act, and it put standards in place for child safety, but it also developed and built out a robust early learning system, a quality rating system, so that people knew, customers of childcare, if you will, knew that they were putting their children not just in safe places, but enriching environments. And it took a lot of work. I mean, the thing that's nice about our state, and maybe it might be different in other states, is that they really involve families and providers in the development of standards. So, for instance, one of the big questions that often comes up is should there be some kind of a credential for people working in early childhood? And what you will find is that to work in childcare, you could probably get a better job if you're in Seattle working at like a parking garage or something. It pays really horrifically. And so there was a lot of pushback um, in the state of Washington, but across the country about what to do with the credential. And so after a lot of negotiation, what we found is that competency was the way to go and training. And so I just think that's really critical. I mean, I think as we move into a space of talking about standards and support, there's two things I think that are really critical. One, it's going to be really important to involve people who are directly impacted, coaches, rec managers. And the second thing is not to throw people out of the current system. So you don't say, okay, everybody's got to have a BA degree, and there's somebody who's a family home provider of childcare says, well, I don't have a family, I can't go back and get a degree. Plus, it doesn't pay much, but I've been doing this for 20 years. You're going to throw me out. And I think the response from the state is let's provide training and support. And so I think those two things of making sure that the community is engaged and then also leading with training and support as opposed to mandates because it's hard. You're making a shift. And I would say now that what's happened since 2015, when the state really moved to putting these things in place and a rating system and putting sort of standards in place, is it has lifted the quality. We're considered one of the highest quality states when it comes to childcare. Our state-funded preschool program is in the top quadrant. We had 9 out of 10 standards in a national evaluation in terms of quality. And of course, the Head Start program with its performance standards is considered a gold standard and is updated pretty frequently based on new evidence and research, which I think would probably be the third leg of this, which is, if you put standards in place, you'll find some work, some don't, and also there'll be new research that we didn't know about concussion or this, or different things that are going on. And so it will require regular updates and communication. So I'll stop there and see if Julie has anything else, or if you really do want to ask me about the NBA playoffs, I'm happy to provide my
we'll hold on
perspective.
the NBA playoffs, but there was so much in there that threads that I want to pull through. Like good intentions aren't enough. That I think that's something we can really take to heart in youth sports. The importance of data, same as Susan told us about. The involvement of stakeholders in setting the quality standards, I think is something we can really take away and is why we want to act proactively in youth sports so that the stakeholders can be the ones to make policy and shape policy. And then also the last one is just the pushback of the workforce, right? We have a mostly volunteer workforce in youth sports. So setting high standards really is attention when we're not paying people or paying people low wages to do the work. So I'm actually going to hold on questions and have you and Jesse answer some questions together because I'm going to bring Jesse up. She's going to talk about out of school time, which has some really like a similar story arc. So thank you, Joel, and we'll get back to you with more questions at the end.
Sure. Thanks, Julie.
Okay, so Jessie Newman is a principal researcher at the American Institutes for Research, and she's going to talk about the quality standards movement in out of school time, which again parallels some of what Joel's already told us, but hopefully we'll reinforce some of these same ideas. Thanks for being here, Jessie.
Absolutely. Thanks for having me. And as I was listening, there's a lot of parallel here. So for everyone listening, let's see if you can count all the things that I say that have already been said before. But, when I think about out of school time, I want to just start with a few definitions for everyone, just so we're on the same page here. When we're talking about out of school time or OST, we're really thinking about programs that serve young people outside of the school day. So after school, summer learning, community-based youth programs. And within that field, we use the term quality to talk about the youth experience. So things like supportive relationships, engaging activities, youth voice, building belonging, how we're developing skills. And then we have quality standards, which are the shared frameworks that the field has developed to define and support those experiences. Now, in out of school time, the work is driven by a large and really diverse workforce, often part-time, varied backgrounds and training. So tying workforce support and professional development closely to the broader quality movement has been a big theme over the last 30 to 40 years. So I want to do just a quick history recap of kind of where we've been and how we got to where we are in the out of school time field around quality. In the 1990s and the early 2000s, I think a few things kind of happened all at once. One being that out of school time programs were expanding rapidly due to changing workforce patterns and concern about unsupervised young people, especially during those 3 to 6 p.m. hours. Around that time, too, federal investment had increased out of school time program access through the 21st Century Community Learning Centers initiative. So we're expanding access, creating more after school programs, not necessarily with an eye toward quality at first. So just keep that in mind. Also, at the same time, I think just in the education field more broadly, accountability pressures were growing, right? This was early No Child Left Behind. And so there was a lot of research and evaluation on these out of school time programs that was happening. And emerging research was really starting to show something that I think we're also seeing in sport, which is participation alone is not enough. It's really about the quality of the experience, right? So I think, a few things for me as a researcher that stood out at that point. One was a report from the National Research Council that, took years of study and looking at multiple different research reports to articulate 8 features of positive developmental settings. And that's a lot of what we now know in the out of school time field as quality. Early 2000s, there was a meta-analysis, so a study of studies that also reinforced a few findings. One being that taking a strengths-based approach to positive youth development was beneficial, and that intentionally designing programs tended to produce stronger outcomes than more unstructured drop-in type of after-school programs. And so, a lot of evaluations at the time were finding null or sort of mixed results. And this was one of the key takeaways, that those types of programs that were really well designed were showing better outcomes. I think another major driver was private philanthropy, largely from the Charles Stewart Mott Foundation. They began funding statewide after-school networks in the early 2000s, and those were designed for a number of reasons, but they helped to coordinate partnerships, advance policy efforts, and really focus on building the quality and quality improvement systems across states. And there was a few that started in 2000. At this point in 2026, I think all 50 states have them, and then some. And so these networks really began developing shared definitions of quality, what we now know as quality standards, that were informed both by the emerging youth development research and from learning from each other, right? The networks became a network of networks and really became a community of practice. So we'll drop a link to an overview of some of that work, which we've supported here at AIR in the chat. But I think the key takeaway here is that, when you put that all together, it really helped to spark what is now the modern OST quality movement. And over time, I think we've seen a fairly consistent set of quality principles emerging, state by state at that statewide after-school network level, but consistently across the country. Frameworks, tending to emphasize how to create safe and supportive environments and to build relationships, what it looks like to, build skills intentionally, be culturally responsive. So I think, there's a lesson to be learned here about how these state networks have come together. But I think another thing to just note is that these were framed around tools as for continuous improvement and workforce support. They weren't punitive accountability tools. So they were often paired with quality assessment tools, right? They weren't just standards documents that sat on the shelf necessarily. And so, I think as we reflect on what we can learn from the out of school time field, it's important to note this happened without a single comprehensive federal out of school time policy. We still don't have that in our field. And I'm not saying that's the right way to do it. It just is the fact. Really, our field has evolved through what I would call little p policy, statewide quality frameworks, funding incentives, seeing this tied into grant requirements and technical assistance systems. Programs aren't usually required to adopt specific standards legally, but if they want funding, if they want technical assistance, if they want to participate in broader systems, that alignment needs to be there. And so I think that's really created significant field-wide, coherence. Not to say there wasn't pushback. I think some people were worried that standards would overstructure a space that was really valued for flexibility, creativity, relationships. Feels similar to where we are in sport. But I think over time, the field has really come to see the standards as a way to name and strengthen good practice, right? To give a voice and words to that secret sauce that is out of school time. So I think that's a really valuable lesson. I'll pause there.
Yeah, no, thanks, Jesse. That again, so many good parallels. I think I would say probably out of school time is the most similar to the current state of youth sports. And some of the things that I heard were just like the creation of these state networks. There's a lot of coalition building happening in youth sports right now, and these sort of bubbling up of regional and state level and city level networks to do this kind of work, and also philanthropy investing in that. So just like in 30 seconds, any thoughts about like, yeah, what is the next step you think youth sports could take on those quality standards based on what you know about where they are now and what happened in the out of school time space?
Yeah, I mean, I think you just said it, right? Like, I feel like there's so much that is similar, and we're there with the Million Coaches Challenge, with the significant investment from the Susan Crown Exchange, the good work that the Million Coaches Challenge partners and others are doing. I think we're at a place now where like the seeds are planted, and it's more about like the watering and care to help it grow and finding ways to keep it connected so that we don't wind up operating in silos, right? I mean, every state had their standards, but they were part of the network of statewide after school networks, right? So more resources and funding to keep people together for that shared learning, but the seeds have been planted.
Yeah, it feels like the seeds have been planted, but we're still a little bit more decentralized, which is
And
actually a
commercially
nice.
driven.
What's that? Sorry.
And commercially driven, which I don't think the out of school time field was facing. So I do think that's something to
Great point. That's another pressure that we have
Yeah.
to contend with. Yeah, and I think on the sort of lack of federal guidance, like that's a great segue to our last guest who's going to talk a little bit about that, and in both out of school time and childcare, and even a little bit in the smoking prevention space. You hear about these like state by state policies, which is great because it allows for the hands-on, involvement of stakeholders at more of a local level, but it also creates challenges because there are different policies state by state, right? And for you sports providers who operate across the country, that can be a real challenge, which is, why the sort of more centralized approach in other countries can make some sense. So we're going to bring on our last guest to talk to us a little bit about that more federal state relationship. So Cesar De La Vega is going to talk to us about an example from the education sector where there was centralized leadership from the federal government to incentivize heightened focus on youth wellness in schools, the sort of youth wellness movement. Cesar is the managing director at Change Lab Solutions, where he focuses on health and education policy. Thanks for being here, Cesar.
Thank you so much, Julie, for having me. Good afternoon, everyone. I want to begin by defining school wellness policies just to ensure we're all starting from the same place. So school wellness policies are written documents that outline how school districts plan to help kids eat well, be physically active, and lead healthier lives. They set nutrition standards for food and beverages available on campus and define benchmarks for physical activity and education. They can also provide guidelines for nutrition promotion, nutrition education, and other school-based activities that promote student wellness. As an example, my local school district instituted a student wellness plan to ensure compliance with its school wellness policy. And within that student wellness plan, the following standard was set. Quote, drinking water will be available throughout the day from clean and functioning drinking fountains. Pretty basic, non-controversial stuff, right? So every student should have access to clean drinking water at no cost to them. I think that's something that we can all get behind. Granted, school wellness policies go far beyond this specific standard, but I just want to paint the picture of how a policy is used to ensure that this most fundamental of human needs is met. And so you may be wondering, do all school districts have a school wellness policy? Is it required, and by whom? So let's get into that history a bit to detail the relationship between policymaking at the federal, state, and local levels. Since 2006, federal law has required that all school districts participating in the National School Lunch Program and/or the School Breakfast Program adopt a local school wellness policy. In 2010, Congress passed the Healthy, Hunger-Free Kids Act, which added additional requirements for local school wellness policies. And in 2016, the USDA issued a final rule on wellness policies. The USDA is the federal government agency that's tasked with overseeing local school wellness policies. So why were these actions taken at the federal level? What problem was being addressed? While this requirement around school wellness policies reflects the essential role that schools play in promoting student health and fostering lifelong healthy habits in children, and some of you may start to see some parallels here with youth sports. Political will was there. Not only could folks point to quantitative and qualitative data from studies showing how critical of a public health issue this is, but you also had lawmakers wanting to take action to be responsive to the needs and desires of their constituents. And so they cleverly devised an approach where they leveraged the funding mechanism as an incentive, in this case, dollars for the National School Lunch and School Breakfast programs to, again, promote student wellness in schools. In response to these actions taken at the federal level, we then saw partners at the state and local levels of government take action. And we also saw many community-based organizations and national nonprofits also plug in to help build out the proper infrastructure and knowledge sharing that is essential to carry out the implementation of these federal requirements. We saw, for example, some partners develop school wellness assessment tools to measure the quality of a district school wellness policy. We saw organizations develop model school wellness policies, others produce tools for implementation and evaluation, and some produce resources to further strengthen wellness policies, again, to be responsive to the particular needs of a local district. In my home state, the California Department of Education monitors compliance with the local school wellness policy during its administrative review, which occurs every 3 years. It also provides trainings on wellness policies and offers technical assistance when the standards are not being met. In short, we saw invested stakeholders across governments and across sectors rise to the occasion to ensure that this opportunity to promote the health and well-being of students, again, presented via this federal regulation, was not only met, but could go above and beyond. And that takes me to my next point, which is around, again, the federal, state, and local relationship. In the story of school wellness policies, we saw the federal government take action by setting federal minimum requirements. In essence, they said to the local school districts, at the very least, you must ensure that the students have access, again, to pull from my earlier example, clean drinking water from a functioning drinking fountain. But states and local districts were also left free to go above and beyond these minimum requirements. And that's where the true potential and beauty of the school wellness policy story really takes off. We don't have time to get into the weeds of that today, but I'll share some links in the chat for those interested to learn more about the creative ways that states and local districts have used wellness policies to promote the health and well-being of students. This school wellness policy story is an example of, to use some technical jargon for a moment, floor preemption. Floor preemption occurs when a higher level of government passes a law that establishes a minimum set of requirements and allows lower levels of government to pass and enforce laws that impose more rigorous requirements. I'll also share in the chat some resources on this topic from my organization. In closing, I'd like to emphasize this critical moment in time, specifically the golden opportunity for action at the federal level to help set the floor for youth sports, to set the bare minimum standards and requirements, all in service of ensuring proper safeguards and protections around the things that so many of us have a shared interest in and shared commitment to, such as 1, youth sports as a tool for healthy development, 2, youth sports as a social right that every young person should have access to, and 3, youth sports that promote the safety and well-being of youth and prevent harm as much as possible. As was mentioned at the top of today's webinar, policy conversations around youth sports are already well underway, and it's my sincere hope that the stories and resources shared today can provide a spark and leave you all feeling more informed and equipped to get involved and shape these policy conversations and to truly center the needs and dreams of our youth today and for the generations to come. Thanks, Julie.
Yeah, thanks so much for being here. Gosh, all these bring up bring up so much for me. Your example of the drinking water, right? Clean drinking water. That's like a pretty clear basic floor that that is being set. And it just strikes me that there's so much that the federal government could do to set that floor in youth sports as well. And instead, what we have right now, instead of a proactive policy that sets some standards, we have a reactive policy about getting private equity out of sports. And then that's the conversation that we're going to be having, instead of having a conversation about like what's the basic that every kid should have, like has a social right to. So that came up for me as I was speaking. And just maybe briefly before we bring everybody back on, you know, what would you picture from what you know of youth sports and what you've heard today, sort of a federal state partnership and an application to youth sports?
Yeah, I think when you think about the standards that are being set at the federal level and then implementation that happens perhaps at the state and local level, it really boils down to two things for me, which are understanding and accountability. And so I think it's important to identify which state agency, for example, might be in charge of oversight once the federal regulations are passed. And so, with that oversight, I have to wonder, are they adequately resourced to carry out the required functions of doing that? And then also who is taking the lead at the local level? In the case of school wellness policies, it was the local school district who might be that analogous entity for youth sports. And finally, I think it's about the democratization of information and how critical that is to ensure accountability. So does the general public know who was regulating what, who was implementing, and how are things being evaluated? And, as folks mentioned earlier, what opportunities are presented to local residents and community-based organizations to provide feedback and help those in policy-making roles understand the impacts of their laws on the ground, and where appropriate, voice when things need to be rectified or adjusted to eliminate, unintended consequences. And so I think if we keep some of these considerations in mind, we can have a successful movement in youth sports.
Yeah, and I think that's a really interesting point that you made, that even though the federal government was involved, which I think many people would think, well, that's going to be too heavy-handed and too top-down. What happened in the case of school wellness is similar to what happened in the other cases, where stakeholders came together to create the quality standards that they wanted based on this sort of floor that the federal government gave, and then being able to receive incentives for doing that work. Yeah, let's, Jennifer, if we could bring everybody back on. We have some good audience questions, and have a few other questions for folks. Thank you. Awesome. This is great. So much overlap. I have to say, the one thing, like everybody said, was data. And as a researcher, it sort of does warm my heart, but also it is a challenge that we have in the space. But so we'll leave data for a moment. And I'm going to pick up on something Jesse said before we go to the audience questions, which is that there wasn't corporatization in the out of school time space, and not in the childcare space, there, and not in the school wellness space, but there was in the smoking example. So I'm a little bit curious about youth sports. Does have a lot of corporate interests, and so that's where a lot of pushback will come from. So Susan, I wanted to just ask you your thoughts on how to address the sort of corporate pushback that you experienced, and any lessons that you learned. And then if anyone else wants to add in on that, happy to hear it as well.
Oh, thank you. Our opposition was well funded from the tobacco industry, but they used local bar and restaurant owners to be the face of the opposition. So I think our challenge was to be respectful to small business owners, while staying on our public health message. And I talked before about the importance of going back and measuring what you've done. So as communities went smoke-free, we were able to demonstrate that bars didn't go out of business. Restaurants didn't go out of business. In fact, some reported they had better business. So, we slowly were able to get some of the restaurant and bar owners to join with us. And, I think that was so important, that then we had different messengers to help with that economic impact part of the argument. While we could stay on public health, we then could turn to partners who really had a skin in the game to talk about how they didn't experience a business loss when their community went smoke-free.
Well, and also then there's a business advantage to being a place that is smoke-free, right? Because there are some people that want that.
Yes.
Yeah. Does anyone else want to add anything on that in terms of
Well,
pushback?
yeah,
Jill?
I mean, my wife was here. She would agree. That's her big complaint when we go to Vegas. Wouldn't they make more money if they if they just went smoke free in the casinos? But I was going to say the other thing I worked on a few years ago was Seattle preschool, and that has very high standards. We went on a listening tour across the country to learn what other high quality preschool programs were doing, but the reason why I think it was successful again is we brought in a lot of the people who were doing the work. I mean, there's no way that this would work if they said, well, let's just hire all the students from, UW to do this because they have bachelor's degrees in early childhood. So that wouldn't work. They have to rely on existing childcare providers. And so there was a real need when I think of sort of opposition. We didn't really have opposition other than, crazy right-wing people who are doing stuff. Maybe the same people are the smoking people too that support, cigarettes or whatever. But the concerns were the direct stakeholders that were fearful, and for good reason, that they might be pushed out of the industry. And
Yeah.
so how important it is to build bridges with those stakeholders and to spend the deep time listening and creating some flexibility. I think that's where it gets hard, because if you ask the early childhood folks at UW or any of the early childhood departments, they'll say, well, absolutely, they need a BA degree and we should have, super small ratios and they need this and that. But what's actually feasible? And I think especially when I think of youth sports, it's all volunteers. I just got a message saying, hey, do you want to coach track? I hadn't coached track like in 6 years. They said, you don't need any experience. Just come down. We'll show you what to, and they're desperate. I find that every year with basketball, it's really hard to get people to do it. They're looking deep into the, moms, dads, volunteers, anybody to do it. So you really have to bring all of these people together. You just lose a lot of people, but it
Yeah.
can be done. I think that's the main thing I wanted people to leave is like, you can do this. You can protect the health and safety and wellness of children and also honor the people who, in this case, they're volunteers mostly, but also with early learning, the workforce. You don't
Doing the
don't
work.
have to
Yeah.
do one or the other.
Yeah, and actually that brings me to an audience question on that note, which I'll put to Jesse first, but then Joel, you could weigh in. Have you found that caregivers appreciate the regulation and the quality standards now that it's been operating a while? And how has that implementation gone with those folks who maybe were, reluctant as a workforce to take that on? Jesse?
Yeah, it's an interesting question. I saw that in the chat, and I don't know that caregivers necessarily appreciate the nuance of quality standards in the out of school time space, but I will say that it's an expectation now. It's no longer just like a place where you drop your kid off and you don't really care what they're doing, right? You know that they're going to be in a space where people are kind to them and they see them as human beings and that they will develop skills and build interests, right? I know I have that standard for my child's out of school time programming. And so I don't know if it's necessarily understanding the nuance, but there is, I think, an expectation. We've really raised the bar on what we expect for quality out of school time care. And I would say the same thing for staff. I mean, Joel, to your point, like the out of school time workforce is very similar. It's largely volunteer, different kinds of training. You have to be really careful about putting too much on the backs of the workforce. But also, I think it's really been recognized as a way for them to grow in a place where I think we're trying to consider how we professionalize the field. And I think it's appreciated in that way too, as long as it's supported, right? No one wants an unfunded mandate. But paired in that way, I think
Yeah.
it works.
And
I
just to add,
totally.
in
Yeah,
out
go
of
ahead.
school time, a lot of the funding was from philanthropy more so than at the state level. Is that right, Jesse?
Well, I think it's both. And
Okay.
where it started is one thing, and where it is now, we don't have federal policy for out of school time, but we do have federal funding for the 21st Century
Okay.
Community Learning Centers program. And I think over time, again, you're not required to implement state standards, but the general consensus of what a quality program looks like and what it should do as specified for the 21st CCLC program is very different now than it was 30 years ago because our understanding of quality practice has evolved.
Great.
I was just going to add, Julie and Jesse, thank you. Though I completely agree. I mean, I think the biggest benefit I've seen from childcare providers in the state of Washington, as well as the Head Start providers, they see themselves as professionals. So it went away from, I'm a mom taking care of some kids, but they have pride in being considered a professional, and that there's
Mhm.
science to this. This is not just
Yeah.
maternal. And
Yeah.
I think the other thing is, yes, sometimes, I mean, if you put standards in place, people will find issues and problems. Having some uniformity, where all the boats are lifted creates that equal playing field. But I think the other thing is, if you build the supports in, the training supports, like a lot of our childcare providers, they like having the coaching that UW does, around working with kids with challenging behaviors or kids with special needs, or math, or we have somebody coming to a conference soon around neurodivergence. Like, they really appreciate that. So I think they see themselves as professionals, which I think is a huge paradigm shift. And two, building in those supports, makes a huge difference. But you have to build the supports around some standard.
Yeah.
And I think that's made a big change in our field.
Right. And I mean, it's similar to teaching, right? You can set high standards, but you also then have to have high support. So we
Yeah.
wouldn't want to create a system where we were setting high standards, but not providing any resources to support the folks who are implementing it, which goes to another question about incentives, which I think this is also a little bit to Jesse and Joel, though Cesar and Susan, you might be able to weigh in, like the incentives. Was there any conversation of incentivizing like the individuals or the schools or the spaces who were meeting regulations, or were all the incentives really framed as a public health incentive, right? Like, if we do this, this is better for the field, this is better for children. Cesar, why don't you take that, because there were incentives built into to the school wellness policy.
Yeah, and in the school wellness context, as I mentioned, there were um, financial incentives related to participating in the school breakfast program, the school lunch program, and there's data that shows the relationship between students who are fed healthy, nutritious food and their ability to learn in the classroom. And so, teachers have the incentive of they want their students to show up as, as the best version of themselves. And so that's one example of like threading the needle. But I think, financial incentives can go a long way in terms of getting folks to implement and adopt. And so I think with school wellness policies, there was also an interesting incentive in that by setting the floor, there was opportunity for creativity and dreaming up like local school district wellness policies that were tailored to the specific wants and needs of community members. And so it's not often that you get sort of that canvas to work from to push for things that folks care about. In some districts, you might see something about mental health and wellness really being emphasized. And so I think just creating that space can really incentivize folks as well.
Julie, the state of Washington, we have our early achiever system. We provide grants to childcare providers that participate, but there's also a stick. So if you do not meet a certain level of quality, you cannot receive the childcare subsidy from the state. And that can be it can be a little hard and rigid, but I would say just about everybody makes it now. I mean, so it just takes a long time, but you do have to have some, as much as we all want to be, strength-based and have incentives and awards and things like that, you need all of those things and scholarships for teachers and other stuff. You do have to have some standard and hold people to it. And
Yes.
people will meet it if you give them the right supports.
And I love that story. It's a great one to end on. People will meet it if you provide the right supports, and we can set a high bar and involve stakeholders in determining what that is and bring people along so that these become expectations. And we hope the same for youth sports, that we can do that proactively. So thank you all for your expertise. We really learned a lot from you. And thank you to the audience for being with us today and helping to learn how we can build some proactive policy to support youth well-being and youth thriving in youth sports. The third webinar in the series, someone asked a great question, like how do we get the first group on board? Well, some groups are already on board, and that's what the third webinar series is about, is what are the policies that are out there, who is moving in some of these directions already. That's on June 16th. All of you here are already signed up for that. So we hope to see you there where we can dig even a little bit deeper to what policy trends are out there already. Thanks, everybody.